After penile prosthesis surgery, patients are usually discharged with an oral antibiotic and an oral pain medication and an oral anti-inflammatory and a neurologic like gabapentin or Neurontin. Pain medication itself will be represcribed every 3 days if needed. The typical recovery period for an inflatable penile prosthesis surgery is 4 to 6 weeks. Some patients like diabetics and those on chronic steroids may take up to 8 weeks for the wound to fully heal. In general, I recommend that you limit your travel restrictions for after 72 hours from the operation itself. I don't want you showering for the first 48 hours as we leave a drain in for this period of time. Once the dressings are removed post-operative day number 2, I recommend that you shower, and no bathing or swimming can be done for 4 to 6 weeks, as the incision is not watertight. I also recommend avoid heavy lifting over 20 pounds for the first 2 weeks. I also recommend that you begin pulling down on the pump in the scrotum once a day for approximately 10 to 15 seconds downwards towards your feet. This will keep the pump at the bottom of the scrotum. This is key as the pump can start riding up after the surgical procedure. In general, my patients after penile prosthesis can drive the next day after surgery so long as they have not taken a pain pill within 3 hours. As far as work schedule goes, it depends on your profession. If you're doing heavy lifting and have more strenuous activity, you may want to take more time off from work. In general, I recommend patients that have more sedentary work schedules to take at least a week off of work. However, if you have more vigorous work schedules where you may be heavy lifting, you may want to take up to 4 weeks off from work. If the incision site was in the scrotum, the stitches will dissolve. You may want to put some Neosporin over the stitches themselves and keep the incision site clean and dry. If your stitches were performed just behind the head of the penis, subcoronally, you should put Neosporin every day over the incision site and wrap the shaft up. You may get some swelling on the underside of the incision. This is normal. This lymphedema or swelling will go away with time. Continue wrapping and follow back up with me, and we can talk about other therapies to help reduce this. The pain medication given to you after penile prosthesis, especially if it's a narcotic, may constipate you. If you're constipated over 48 hours, I recommend that you try using a half a bottle of magnesium citrate to help empty your bowels out. If you're having bloating or inability to have a bowel movement or inability to urinate, you may want to call us. It's normal for you to have bruising and swelling of your scrotum. I leave the drain in to help mild and mitigate this response. It's really important for you to ice the scrotum 4 to 5 times a day for 30 minutes. This will help improve pain and swelling. If you're having fever of 101, uncontrolled pain, drainage from the incision, redness, or questions about the surgical procedure itself, call our office at 404-400-3120. After the surgical procedure itself, we will make an appointment for you to have your drain removed approximately 1 to 2 days after the surgical procedure. I will see you back at 2 weeks from the surgery itself, and we will begin cycling or inflating and deflating the penile implant. This gets you ready for intercourse. At 4 to 5 weeks, we'll see you back and take a look at your incision to make sure it is closed and clear you for using the penile implant. After the penile implant, patients can generally use their device between 4 to 6 weeks so long as the incision is healed. Certain patients like those who are diabetic or are on chronic steroids may take up to 8 weeks to use their device, as it may take longer for their incision to heal. Should you have questions in your recovery, please call our office and get a hold of me or one of my nurses. Our office number is 404-400-3120. If you have other questions about your surgical procedure, go to our website at www.atlantacosmeticurology.com. Under the links in the top bar, there's information on post-op recovery kits and also other written post-op instructions for you.